Hi, I'm Dr. Paul Chasan at Ranch and Coast Plastic Surgery. I'm a board-certified plastic surgeon. I've been in practice 25 years, and rhinoplasty is one of my favorite surgeries I do. I'm very passionate about it. I do about 4 to 5 rhinoplasties a week. And the consistent thing that I kept seeing in some of my post-operative patients, I'd say at least half to 2/3, especially in the thick skin patients, is this. You see that super tip swelling? That's the frustrating thing for all of us plastic surgeons who do rhinoplasty. And night taping, steroid injections, and it got a little better, more night taping, and a lot of patient being impatient, night taping and steroid injections. Eventually I got her to a nose that was acceptable. I really was looking for something that could shortcut this, something that the patients would use, something that might get more patient compliance. And that's how I came up with this. And this is, we call it Nose Perfect. And it's a small plastic device. I'm going to put it in my own nose right now. Sometimes I bend these little prongs out, but you can see right here, when you put it in, it's designed to be able to fit and put compression right on the super tip area. And you can see it here, and you can see it here. And I generally start these at about 3 weeks post-op. I find that the patients are a little too sensitive at 2 weeks. So I might have them night tape for a week, and then I put them on the Nose Perfect device. I usually have them use it 2 hours in the morning or 2 hours in the evening. The report from the patients is that it's comfortable, they like it, they see a big difference. Even later, if they have a salty meal and start to get a little swollen in the tip, they just start again with the Nose Perfect device. But my patient compliance with them is almost 100%. I'm going to show you a recent patient that I started on Nose Perfect. And here you go. I'm going to take this out just not to distract you. But this is a patient who is starting to get that super tip swelling. And you can see it right there where my pointer is. And this is, I saw her 2 weeks later, and she was using it about 2-3 hours a day. And you can see just the difference just by using the Nose Perfect device for 2 weeks. So I have found for my patients, it's much more comfortable. There's a lot more patient compliance. It works. And so I would say if you're a plastic surgeon or a facial plastic surgeon that does a fair number of rhinoplasties, you need to start using this. I've given this to several of my friends who are plastic surgeons who do noses, and they really like it, and they report back to me that they are using them. And trust me, you know, in our world where plastic surgeons are always critical of each other, I would tell you that every one of these plastic surgeons, if it didn't work, they'd be telling me, oh, I would do something else or have their input. But actually, I've found that 100% of the people that I've given it to, the patients and other plastic surgeons, have really liked this device. Also, with COVID and people using masks, people are telling me that they feel like their tips drooping. And you know, I started a couple patients that didn't have rhinoplasty, but they were concerned about their tip drooping from using a mask, and they started wearing it and they noticed a difference. So I think as a nose shaper, this thing might be really important because everybody's wearing masks and their tips are drooping, and this might be a really good anti-gravity device for the COVID mask nose.